very warm welcome to all the parents listening to this session. I am Dr. Parag Dekate. I am a clinical director of pediatrics and a senior pediatrician at KIMS Cuddles, Kondapur. Today we are going to talk about monsoon. As we know, there are a lot of diseases related to the monsoon in this season, and there are a lot of questions we see in our social handle. And today we are going to clarify about some myths and questions related to the monsoon. So we see cough and cold both in the monsoon season as well as related to the COVID. As we know that our whole world is suffering from COVID, it's very difficult to differentiate between the cough and cold related to COVID as well as monsoon. But there are some soft pointers which points us towards the COVID illness. What are those? So high spiking fever, myalgia, loss of taste and smell, and breathing difficulty are all suggestive of COVID infection. While the cough and cold related to monsoon, usually it lasts for few days and rarely it progresses to the breathing difficulty, and most of this cough and cold related to monsoon doesn't require any medical management. So because we are dealing with this pandemic since long time, now we can actually make our children go outside and play, but following all the standard precautions. So what are those standard precautions is? So make it sure that mask is on all the time. They are frequently utilizing the sanitization, that is hand sanitization. Third thing is make it sure they have a full clothes, and they are maintaining a adequate social distancing, which is around 5 to 6 feet. And it is always advisable that there is an adult overseeing this play so that all the kids are following these precautions. For the kids playing into the rain, at this moment it is not advisable for the kids to play in the rain because of two reasons: that the pollution is increasing very rapidly in and around the Hyderabad. So most of the water which we see might be a polluted water, so it's not a good idea for the kids to go and play in a polluted water. And second thing, because of the high-rise buildings and shades used, the lot of water fall on these buildings and shades and come back to the kids, so which itself is a dirty water and which can warrant a lot of infections. So it is not advisable for the kids to play in the dirty rain water. So during monsoon season, we see a lot of waterborne diseases. What are those? These are acute gastroenteritis, gastritis, frequent vomiting. We call sometimes as a gastritis with vomiting. Then we have a typhoid. Again, these are all waterborne infections and completely preventable. So how do we protect our child from these infections? So there are two things needs to be seen and observed and follow. One is a good hand hygiene, so frequent hand washing and utilization of hand sanitizer. Second is make it sure that you have a safe and a clean water as well as a good and hygienic food. So how to do that? So make it sure that kids are eating inside the house and avoid the roadside food which is full of infections and give rise to all those infections related to the waterborne diseases. So it is common to use mosquito repellents in any of the house, but if we are following the standard manufacturer guidelines given, so they are actually safe for all the kids. But once we start utilizing them in a higher concentration or for longer duration, it might cause some health adverse effect. And second thing which is very common in a small toddlers is ingestion of these repellents. So make it sure that they are not readily available so that we can prevent the ingestion of this mosquito repellents. But you can safely use all those repellents including skin vaporizer as per the manufacturer guidelines. So as we know that we are strictly following social distancing and hand hygiene since long time because of the COVID, it is really very important also in the monsoon season. So what are the things we need to do differently during the monsoon season is: one, take care of yourself. So how do we do that? Frequent hand washing, hand sanitization, using full clothes, because this is a season where the chances of getting dengue is also very high. So if you are utilizing the full clothes, the chances of a mosquito bite goes down. Second thing is safe and clean water practices. In the way you can utilize RO water, you can utilize boiling and then cooled water, so that the chances of waterborne diseases is down. Third thing is safe and hygienic food, which will prevent from other infection related to the food. Avoid roadside and outside food, and obviously you should not promote any junk food during this season because of chances of contamination. Second thing is a high chances of having a gastritis related to this junk food. So the food to be avoided during the monsoon season are all junk foods and food and drink from the outside vendors and the roadside eateries should be completely avoided. And the question about ordering food from outside, if you are very comfortable about the hygiene standard followed by the vendor, you can try food from that place, but it is not recommended to use outside food during the monsoon season because of the higher chances of infection related to that. Thank you.